Hey everyone, this is Mrs. Lewis. I'm going to give you a quick video on hemodynamics. Of course, it's not all inclusive, and it's just a few points to remember for the hemodynamic lecture and for maybe even NCLEX. So just some things to remember. So what is hemodynamic monitoring? It's just the measurement of pressure and flow and oxygenation within the cardiovascular system. It's just, we're assessing the heart function, we're assessing fluid balance, we're assessing the effects of fluids and drugs on cardiac output. And this can be invasive or non-invasive. Now, what I'm going to talk about is the invasive type, and those are internally placed devices. And non-invasive, you'll see those at clinical. I know one non-invasive monitor is called the Cheetah, and you'll see they just put these stickers on the patient. It's very non-invasive, but it will give them some readings. You know, it gives you different things like your pulmonary, your central venous pressure, your pulmonary artery pressure, oxygen, SVO2. So it gives you all of that, and it's very useful, and you'll see it mostly in ICU. So let's just review right quick, what is cardiac output. This is a good little reminder. Your cardiac output is your amount of blood pumped by the heart in 1 minute. So it's the amount of blood pumped by the heart. So 4 to 8 liters, so that's a lot, 4 to 8 liters. And then your heart rate is your beats per minute. It's also a factor in cardiac output. And then there's your stroke volume. And that's just the volume of blood pumped with each ventricle and each beat, so each heartbeat. So that's 60 to 150 milliliters. Cardiac output equals heart rate times stroke volume. Definitely know how to do this. And I've got you an example down here. So let's say you have 75, your heart rate's 75 beats per minute, and you have your stroke volume at 70. So you just multiply that. But again, take into account that you're getting milliliters, so you have to convert that to liters, as I did here. 5250 divided by 1,000 equals 5.2 liters per minute. Now, if you were to have this turned around, you might be given your stroke volume, or you might be given your cardiac output and your heart rate, and you have to divide to get your stroke volume. So keep that in mind. But again, often you will have to do the math to go from liters to milliliters or milliliters to liters. This right here is your Swanganz. It is a type of pulmonary artery catheter. Pulmonary artery catheter, remember, it measures central venous pressure. It can measure different things. Again, that is your invasive type monitoring, and Swanganz is just a name brand. So this is a picture, and it has your Swanganz sitting here in the right atrium. And this measures your central venous pressure. Central venous pressure should be about 2 to 8 millimeters of mercury, and this is a way to measure your preload. Now it's sitting here in the right atria, but you know your preload is your ventricle. Measuring your ventricle. So your CVP is measured in your atrium, right at the bottom of your atrium or your ventricle, just at the and it is the right ventricular preload or right ventricular end diastolic pressure. So just remember that is what is measured there, and it measures your CVP. Now, you'll hear people say, what is the pulmonary artery wedge pressure? And I had a question about that. And that is just the same catheter here that is moved and then pushed up through your pulmonary artery. Okay? So that is this is just a smaller picture, same heart. Now, this is the same pulmonary artery catheter, your Swanganz, and it has moved up, and they put it here and they wedge it. That's why it's called wedged, right? It's wedged in. and that is your pulmonary artery wedge pressure, and it is 6 to 12 millimeters of mercury. It sits here for about 3 to 5 seconds because, again, you don't want it to sit here for too long, because I put this picture of the lungs here so you can kind of get an idea. Remember, we've got blood and oxygen going through here so that it can be exchanged in the lungs. So it can only sit here for a few seconds because you don't want to disrupt that exchange. Now, I put this picture of the lungs here so that you can see how this pulmonary artery sits here over, the heart. So when you've got that wedged in, you're getting pressure. You can see the aorta sits here. You can see the left ventricle sits here. So that wedge pressure can tell the clinician a lot. So that is why it's sometimes used. It's not as often as it used to be, but that is what we're talking about when we say wedge pressure. Again, I just put this here for your reference. Actually, that should say 4 to 8. I had originally put it as 4 to 6, and I was wrong according to your book. So 4 to 8 is your cardiac output. So we're going to skip right over this, and then I wanted to talk briefly about your ventricular assist devices, your balloon pump and your VAD. There's also one out there called the Impella device that's not in our book, I don't think, but it's used very often as well, and it's a ventricular assist device, left ventricular assist device as well. But I wanted to just talk briefly about these. So first we're going to talk about your balloon pump. Again, this is just some points to remember. I'm not re-lecturing this because you've already had this lecture, and you've also read it. Also, you should have read in the book about it. But your balloon pump, and again, we're not teaching you to be ICU nurses. This is just so you'll have some basic knowledge of what these do, and what kind of complications can can come from these, because of course you're probably not going to start off in the ICU, but you may get a patient that had one of these, or you may get report from an ICU nurse, and you at least kind of need to know what they're talking about. So let's talk a little bit about the balloon pump. The balloon pump is kind of like a vacuum. During diastole, it inflates so that it can augment aortic pressure. Now again, remember, your left ventricle here is somehow damaged or not working properly, or maybe the myocardium is hypertrophied, or maybe there's a place of ischemia right here from a heart attack, and it's creating some problems with the pump. So remember, your left side is your high pressure pump. That is where you get the muscle for the heart, a lot of the muscle. So just remember, that's why this is needed, so that we can also, knowing the blood flow of the heart, because this left ventricle has got to get the blood out through the aorta to the rest of the body. So it's it's got to be pretty strong. So when it's not strong, it needs some help. So that's what this balloon pump does. So during diastole, which is the filling, right, the ventricles, it's inflated. And during that inflation, it augments aortic pressure. Because you've got this pressure system, right, where you've got pressure, and then the heart creates a force of pressure to push it. Well, then while this is sitting here, it's creating pressure so that the ventricle can fill properly. Does that make sense? You want this to be inflated so the ventricle can fill properly. So then, when it deflates here during systole, it's like a vacuum, and it helps pull the blood from that left ventricle on out to the rest of the body. It reduces afterload, and it also helps improve blood flow to the heart. It does this through counter pulsation, and it'll decrease your pulmonary artery pressure and systemic vascular resistance, of course. When we say systemic vascular resistance, we're talking about the blood that goes to the rest of the body, right? So if that's decreased and improved, then you're going to have improved cardiac output, and that is our goal. So that's just a little bit about the balloon pump. One thing I want you to think about too, so someone that does not have a properly working pump, their heart is not working good. Somebody that's in cardiogenic shock, or somebody that's had a major MI and there's damage. Think about that person and think about their cardiac output. What do you think it's going to be on the monitor? If normal cardiac output is 4 to 8, then it may be pretty low because the heart is not functioning properly and adequately. So a goal for our balloon pump would be for you to have a cardiac output of 5 or 6, right? At least 4. So that would be a goal. That would be a positive outcome. All right, let's just talk quickly about the LVAD. I have it here as well. Your LVAD is just your left ventricular assist device that people can go home with. The balloon pump, that is something they stay in the hospital, usually ICU with. The LVAD, they go home with this. You see he's wearing it. He wears it on his back. You can do a YouTube search and see all the videos of people talking about how they're living their best life with their LVAD. And then someone asked me about where, how is it, is it inserted into the patient? And I have this picture here for you. You have an external battery pack, and you see here that right here you have an entry site. So you do have some wires that I'm sure you have to keep, be aware of infection and everything. So you have an entry wire. But you can see that it is, helping the heart. This is a bridge to transplant. And a lot of people live with these for a while because, there's only so many heart transplants. I also just want to go backtrack a minute. Just be aware, too, of your balloon pump and, like, the contraindications for it, the indications and contraindications, So, the indications is a bridge as well to heart transplant. It's sometimes post-op, pre-op, and intraoperatively used. So there's different reasons, cardiogenic shock, so there's different reasons for using the balloon pump. And then just be aware of the contraindications. If someone's got brain damage or they've got a terminal disease or something like that, they're probably not, or aortic insufficiency, they're probably not going to be a candidate. So just keep that in mind as well. There are some reasons why that it would be contraindicated. So that is all I have. Again, it's just a short, not all-inclusive video for you to just review some of your important points. And I hope this helps, and I will see you soon.